Hello and welcome to this session on safeguarding adults. My name is Stephen Davis, I'm a registered nurse and I'm going to guide you through the learning materials for this section. So during this you'll understand the principles of safeguarding adults, you'll be able to reduce the likelihood of abuse, you'll be able to respond to suspected abuse or disclosures, and you'll be able to protect people from harm and abuse locally and nationally. So let's look at the principles. Adult safeguarding is a way of working and thinking that protects adults and care and support needs of abuse from harm and neglect. Safeguarding balances the right to be safe with the right of making informed choices to support the well-being, ensuring that basic needs are met, promoting independence. So harm includes ill treatment, and again we have the definitions of different abuse, including sexual abuse, exploitation, ill treatment, physical, mental health, developmental, intellectual, emotional, social, behavioural, self-harm, neglect, unlawful effects of personal property, rights and interventions, and financial abuse. Also, we look at about informed choices. So informed choice is about being able to make decisions and being provided with the information for you to make those decisions. So what are your responsibilities whilst working in health and social care? As a health and social care worker, you must work in ways that prevent individuals coming to harm. It may be seen as abuse if you cause harm to someone or you do nothing you should to prevent harm. You should follow organisational agreed ways of working. So agreed ways of working refer to your organisation's policies and procedures. Let's look at some of the types of abuse. So physical abuse is when an individual is being injured or hurt inappropriately or use of restrictive practices. So what that means is you can have direct and indirect abuse around adult protection for physical abuse. I may hit you or punch you, and that's direct contact. But if I restrain you or stop you from moving or lock a door and keep you locked in, again, I'm physically stopping you from being able to do what you wanted to do. So that's a restrictive practice. We then have financial abuse, the use of persons' funds or belongings without their permission. So again, that can be directly taking money from them, or lying about services that you're providing and charging them for them, or again using their loyalty cards and point services. We then have sexual abuse. Sexual relationships or activities that involves individuals that do not want to be involved in or they cannot consent to. Sexual abuse again has two forms to it. We have direct contact and indirect contact. Direct contact are things such as me touching you without consent inappropriately. Maybe doing invasive care techniques where I haven't gained consent. Indirect may be the fact that I'm doing sexual jokes. I've shown you pornography or I've made you feel uncomfortable by talking in a way that just is degrading. It may be things that I'm making you take photographs or images or looking at things that you don't want to look at. Neglect is the fail to meet basic needs when providing food, fluid, warmth, medication and hygiene support. We have emotional abuse. This is also known as psychological abuse. It results in people feeling worthless, unloved and uncared for. We have institutional or organisational abuse, and that's simply when a regime is more important than the person we're caring for. So we have fixed processes that aren't personal-centred and don't involve the person. And finally, there's discriminatory abuse, and that's when we treat people less equally under the Equality Act. Now, there are other types of abuse out there, and again, you will have covered those in your child and in your induction training, such as modern slavery, FGM, for workforce labourers and things like that. So these are just the main ones that we're focusing on for this session. Now, the risk of harm means that abuse happens when one person abuses their power. So they take control over somebody's life and exploit them. It's easy to do that with vulnerable people because obviously they're unable to fight back, and sometimes they're unaware that they're being abused. So this may be called grooming or other activities where they're just being manipulated. It's important workers are trained to understand things and understand how to deal with challenging behaviour, because again, you don't want to end up in a situation where you're neglected in your duty of care through lack of knowledge and skills. It's important when individuals have particular vulnerabilities such as sensory impairment or mental health issues, dementia or learning disabilities, that they're supported and people are aware of how to work with them in a personal-centred way. All incidences of abuse must be reported. They must, especially if they result in serious harm or death. They will all be investigated and a serious case review conducted. Under serious case reviews, they'll look at things such as what caused them, so maybe poor communication. We've had many examples in the past in which you can go online and have a look at to kind of understand this in a bit more depth. You can look at Victoria Climbier, Baby P or Winterbourne. You could look at the Mid Staffordshire inquiry, and that was one of the outcomes around staff training development because of the lack of awareness. Ineffective partnership working. Individuals and supporting networks not being involved in decisions about their care, so again, organisational. A failure to identify signs of abuse, so again, could be organisational abuse. Lack of management of resources, so do we have collusion and cover-up going? Limited learning development opportunities for workers. Again, for you, whilst we do this remotely, you can also do other online courses free of charge with the Social Institute Care of Excellence. You can create an account and again have a look at theirs and compare how the two courses look. And poor recruitment processes. Now, the recruitment process is a timely process to get a member of staff in and through the meal. We have to get references, we have to do your DBS checks, we have to check if you're on the Adult Protection Register. So where can you get information, advice and guidance from? Well, we have a set of policies and procedures in which you can gain from our website. You can simply download them, read them and understand them. In there, you'll read our safeguarding policies, procedures and flowcharts, our whistleblowing policies, procedures and flowcharts, and our complaints. You're able to go to your manager or your seniors. You'll receive regular training ongoing for children and for adults. Maybe there's professional bodies like the Royal College of Nursing or your unions. SCIE for the Social Care Institute of Excellence. Social services, CQC, care helplines and the internet. Personal-centred care is really important because it means that we're meeting the needs of the person and we are less likely to cause harm and offence or abuse by doing so. By working in a person-centred way, we're able to gain consent and understand what we're doing. So let's have a look at this, whether it's true or false. Involving individuals in decision about their care and support promotes their rights and dignities. Do we think that's true or do we think that's false? Hopefully we've said that's true. Person-centred care reduces the risk of abuse happening unintentionally. And again, that's true. Care and support meets the individual needs, enabling them to live their lives independently as possible. And again, that's true. Supporting individuals to understand their rights and how they can expect to be treated increases the likelihood of occurring. Hopefully, that's false. Because actually, if we support individuals to understand their rights, we empower them. We give them a voice, they're able to raise concerns, complaints, and people are aware that they're able to communicate effectively. Ensuring that the person has the right equipment to meet their individual needs supports them to participate actively in their care. So again, working in a person-centred way, identifying equipment adaptations to promote their independence, empower them, support re-enablement or enablement should be true. An individual should only be given risk-free choices to protect them from harm. So, are we able to make unwise choices? And the answer is yes. So therefore, I may do things that aren't risk-free, but it doesn't mean I can't do them because I may be making that choice. So that's false. Multi-agency working is really important around safeguarding because it's the only way we can work together as a team and understand risk and consequence. The CARE Act 2014 requires local authorities to create safeguarding boards. These boards look at how safeguarding procedures are put into practice locally. They promote information sharing between workers and organisations. And when an alert goes in, everyone's brought together to discuss it. It's then about managing and mitigating risk. Risk enablement involves supporting individuals to identify risk and assess their own risks, enabling them to take the risks they choose. So they may choose to do a bungee jump and it's completely dangerous and not appropriate. However, if they've managed to weigh up the risk, they have capacity and they can consent, are we in a position to stop them? And if we did stop them, would we be taking their freedom to choose away from them? It's a key part to person-centred working. The emphasis is working with the individual as they're the expert in their own care. Being in control and making their own choices will increase their self-confidence. Feedback, whether it's good or bad, should be welcomed. So it's important we allow an opportunity for comments, concerns and complaints. Your managers and supervisors will be able to tell you what you're doing well and any compliments or complaints that have been made. And we'll be able to look at what some of the advantages are of having clear comments, concerns and complaints procedure. A clear complaints procedure is easy to understand and follow. An easy to use complaints procedure empowers individuals and enables them to raise concerns that they have. Identifying concerns early can prevent abuse from occurring. It promotes an open and honest line of communication. It raises standards in care and gives feedback to individuals receiving care. So what would you do if somebody tells you they're being abused? If an individual tells you they're being abused, it's important that you must reassure them and you will take this seriously. Support them to communicate. Tell them that you cannot keep this a secret and you have a duty of care to protect them from harm. Listen carefully to what they're telling you. Reassure them that you will be involved in the decisions about what will happen. Be non-judgmental and don't jump to conclusions. Record what the individual tells you and don't ask questions. Report the disclosure to your manager. Now, we may then feel that there's not enough still going on and you may feel that things are still not right and therefore you can go down the whistleblowing policy. Whistleblowing, you must report things that are not right or illegal, or if anyone at work is neglecting their duty. This is known as whistleblowing. We have policies and procedures around whistleblowing. Again, you can find them online and you can download those policies. You'll need to speak to your manager, who will normally be the first step. If you're concerned about your manager or the practices, then you can address this with the more senior people, such as the registered manager, nominated individual, and then to CQC. As part of working in a multi-agency group, it's important we share information. Therefore, we need to make sure that people are aware that we will be talking about things and we can't promise to keep secrets around whistleblowing. However, it is on a need-to-know basis only. Working as a multi-agency, sharing information will provide opportunities to share concerns. It enables us to track trends and see if things have happened in other areas. We ensure that well-being is the main priority. We can ensure that individuals are able to access a range of services and resources to protect them. And finally, they can be involved in appropriate working ways to make sure that they're safe and promoted and protected. So, let's just do a quick knowledge check. What are your responsibilities when it comes to safeguarding? So, A, to investigate allegations, and B, to work in ways that prevent individuals from being harmed. C, to challenge the person who is abusing the individual, or to work in ways that restrict the individual's rights. I'm hoping we've gone B. Wonderful. Let's look at this one. If a person has a number of injuries of different ages, which type of abuse might you suspect taking place? Institutional and organisational, financial, neglect, or physical? So when we talk about different ages, we may be saying we've got some pink bruises, some dark bruises, some light bruises, so therefore they're all different colours. So I'm hoping we've gone physical. Here, when should comments, complaints and concerns procedures be clear to easy to understand? To make it difficult for people to make a complaint, to make it easy to complete reports for the CQC, to make it easy for everyone to raise a concern before a concern escalates to abuse, or to make it quick to explain to busy staff. And again, I'm hoping we've gone C. So that's the end of this session. I want you to think about everything that we've discussed here. Link it also to the child protection, because in the Safeguarding Vulnerable Children, we have a lot more categories and we go into a lot more depth about signs and symptoms of abuse. Clearly, there's a lot of synergy and crossover between adults and children. The indicators of abuse, the symptoms and the signs of abuse are there. So that's why we don't cover them so much in this one, because you've already covered them in your child protection one. There are differences between adults and children, so just be aware of those. And again, there'll be different policies and procedures to follow. So thank you for watching. I hope you found this useful, and I wish you all the best, and I hope you never have to use them. If you need further advice and guidance, again, please go online, have a look at your company's website, download their policies, download the handbooks, download the forms, download the safeguarding procedure, download the whistleblowing procedure, and follow them. You can go online to CQC or the Social Care Institute of Excellence and have a look there. Or alternatively, you can go to your local council and read their policies as well. Thanks for watching, and I wish you all the best, and you'll never have to use them in the future.